Good morning. It's my great honour today to talk to someone I've worked with for many years and inspired me, inspired the UICC. In fact, was the president of UICC for 2 years and then moved on to lead the City Cancer Challenge Foundation as chair. But Sanchia, we go back quite a few years, and it's an absolute pleasure to talk to you today. I hope everything's okay in Australia.
Yes, it's not too bad. We are in a couple of weeks of lockdown at the moment, but nothing bad, really, by comparison to the rest of the world. So all good.
Yeah, I think we can all be counting ourselves lucky that we live in Geneva and other places like that. But anyway, the point of today, Sanchia, is to get to know some of your background and what led you to become this icon of global health around the world and have all these leading roles, and maybe talk about some of the work that we've done in terms of governance, which I think is really quite interesting. But perhaps you could give a thumbnail sketch of your career and how you ended up being UICC president, for example.
Mm-hmm. Well, Cary, of course, I started in a bank, a bit like you, but I only lasted a year. Wasn't cut out for that, so you did much better than me. Became a nurse, specialised in oncology, spent some time in the UK studying that, came back, really developed a career in practice and then in education and research, largely focused on making life better for patients. And I guess my career from then just looked for wider and bigger platforms through which to make a difference. So first of all, through the International Society of Nurses in Cancer Care and UICC, and professionally moved into government about 10 years ago for 5 years and learned a lot about system performance and policy and the role of policy in affecting change. And then more recently as CEO of our national cancer charity, Cancer Council Australia, and through that really looked at much more at the role of civil society organisations from a national perspective as opposed to the international perspective that I've developed through UICC. So kind of that's me in a nutshell, and I'm back now being a little bit of a part-time academic and developing a portfolio of board responsibilities. So a bit of a mixed bag.
When you joined UICC, I think we could, your 6 years on the board can be marked by, I guess, two things. The first was, I think, you and I are kindred spirits, believing firmly in that behind every great organisation, there's a great governance structure, and that people need to know who's responsible, who can make decisions, what the role of the board is compared to a CEO. And one of the phrases that you used when you were on our board, and we still use it, was this concept that the board should have its nose in, but its fingers out. It shouldn't be engaged in the work of the organisation. But where do you think you developed your passion for the importance of governance in making an organisation work? Where did that come from?
It probably came really initially from the International Society for Nurses in Cancer Care. We took that, I led that organisation through a 4-year chair term of a transition from being a board of management to a board of governance. And that was at the point prior to that, we'd all done all the work. The nurses who had day jobs were trying to do the work. And for the first time, we employed a secretariat and we started to invest roles and responsibilities in them. And what we found was that as they started to develop expertise, the board directors were really trying to run the organisation, and you can't do that on a part-time basis. And so when I came to UICC, that was an equivalent experience where there were people around the board who came from professional backgrounds in cancer control who really felt that they knew more than the staff. And I can remember some of the staff leaving my first board meeting in tears and needing debriefing and other things because they were not seen as doing the right thing for some of the program areas. Whereas for me, rather than saying that my way was best for any program area, as a board director, what I should be asking is what processes are using to engage experts around the world to help you build these programs? What sort of advice mechanisms do you have? And how do you test the robustness of the solutions that you come up with from that sort of peer-reviewed perspective? And that's the role of a governor, not to tell people how to do their job, because they're spending 5 days a week on it. We are spending one day a quarter, and you just don't have the same level of understanding and in-depth knowledge. And if you want to be part of a program area because of your expertise, you have to step away from it as a governor. And I think we often don't understand those quite specific conflict of interest issues that arise for boards that are probably not the ones that we normally think about.
No, that's true. And I mean, the work that we did with UICC, and I know that work has been replicated in other organisations around governance, allowed everyone to be very clear about who's responsible for what, which leads to decisions being taken and leads to impact and action. And that's one of the things I think is characterised, certainly the work I've been involved with you and I've seen you do with many other organisations, is you're not one for sitting there having a good old chat around the table about an issue. You want to take things forward or disregard them because they're not relevant and have an impact on patients, have an impact on risk factors. I mean, is that sort of a part of your DNA, or is it a philosophy that you've developed?
Yeah, so it's definitely part of my DNA. I can't bear being part of committees and organisations and boards where purpose isn't front of centre and that you don't get the opportunity to actually direct that. And I'm a firm believer, I think the governance structure that we developed for UICC really reflects the idea that what the board's job is to create the enabling environment through which the organisation can do its job, that the paid staff can do that, while at the same time meeting your governance obligations to ensure that that's done according to the laws and processes of the governing statutes and regulations. And so the board carries that responsibility very carefully. And I know that you remember the example of me. What really led to this for me was being told when I asked a question about the budget of the board director who was assisting with that process, that it's okay, just trust us that we'll be able to close that gap. Whereas that's the trust us conversation, the idea that we're across the detail might be okay for a management response, but probably not, but could be. But it's not the idea of governors, that each of us has to understand those kinds of things. And I was so concerned by that response that I thought I wouldn't stand for election again. And so what I wanted to do was be able to work with UICC to transform that thinking and take the maturity of the organisation from a governance perspective forward. And luckily, Mary Gospodarovich, as the incoming president, and yourself were open to that process. And I think we have managed to really get to a good place with the governance of UICC.
I'm so glad your banking training honed you on to the issue of finance immediately. I mean, the two of us both have that background. When you were the president and president-elect, actually, you led the UICC through some big decisions. And one of them was about the City Cancer Challenge, which is one of those sister organisations that we've helped to establish in the last 11 years. The McCabe Centre for Law and Cancer, which is doing remarkably well. NCD Alliance, we've been a founding partner of that, member of that for many years. The International Cancer Control Partnership, done tremendous work working with countries around the world. And then this idea emerged, City Cancer Challenge, which started as an advocacy idea, then became a programmatic idea. And then very quickly, I think a few of us recognized that it had the potential to be quite a powerful member of our sister community in making things happen through the cities in low middle income countries. And we decided that it should probably be a standalone entity. Now, at the time, there were various people in and outside the UICC family saying, you're mad. You've got to keep this inside. It's going to bring in lots of funding for UICC. But I know you led the charge really in the discussion about, no, we need to do the right thing for the community, right thing for cities, right thing for this organisation. It should be established as a standalone foundation. Talk me through some of your thinking there, because that took real leadership, didn't it? It was not easy to convince everyone or to win people over.
Yeah, so the City Cancer Challenge concept was one of those unifying thoughts everyone around the board, everyone we engaged in, loved the idea, were kind of disenchanted with national cancer control plans that had been developed by countries and really sat on shelves because they never produced the funding that was needed. They didn't really bring together the multi-sectorial partnerships that were going to be needed to deliver these sorts of solutions. And so everyone, for that reason, wanted to hold it very close to UICC and saw it as the sort of way to make a difference. But for me, when I thought it through, I took it back to first premises, really. The first is that UICC is a membership organisation and it needs to serve its 1,200 odd members around the world. And the City Cancer Challenge work was only ever going to be in a handful of cities, at least in the short term, and that wasn't utilising the resources of the organisation in the best way of servicing its members. Members could be involved in the cities, and they are and continue to be, but it wasn't serving their interests. The second thing is that for members, one of the most powerful things about UICC, particularly in the era of Cary Adams as CEO, has been the relationship that it has with WHO, and through WHO, the wider UN community, and that ability to influence those UN agencies is very dependent on UICC being separate from the private sector, and particularly organisations like the pharmaceutical industry. And yet City Cancer Challenge was bringing this pharmaceutical industry money in. It was for the foreseeable future the primary source of funding, and so that was going to threaten the relationship with UICC and WHO and do harm to the purpose of UICC. And so I had to really work with each of the directors, some of whom still to this day disagree with that decision to move away. But it really, for both organisations to maintain focus on their purpose, they had to be separate but in relationship. And that I think we always, as governors, should go back to those questions of purpose. That is our job. Organisations often want to grow and develop in many different ways. And so the strategy role of the board in really focusing in on the purpose of the organisation is fundamental in my view.
Yeah, that's an echo of conversations we've had in the past where, when we're looking at creating a new entity, whether that be McCabe, ICCP, or Entity Alliance or City Council Challenge, the form has to follow the purpose. There's no point in having a great purpose and ambition if you structure the organisation in a way which handicaps or limits its ability to deliver that ambition. So they go hand in hand. It goes back to what we were talking earlier. You've got to get the governance right in order for an organisation to thrive, because the decisions have to be at the right level, the right people need to be involved, et cetera, et cetera. And I think, we're learning as we're going along. We're not necessarily always getting it right, but I think, those decisions that we've taken in the past have been the right ones. So Sanchia, what's on your desk at the moment? What are you doing now? Because we miss you in UIC, obviously, but not that you've disappeared, but, what are you doing now? What's getting you up every day, and what sort of issues are you addressing?
Yeah, so obviously I'm still involved as chair of City Cancer Challenge, and I think that I'm very pressed at the moment around the issues of how we scale that. So we've been having a lot of conversations around, yes, we've got these intensive programs within a handful of cities, but that's not actually helping the world fast enough, and that really what are the things that we can draw from that experience and work with UICC to adapt in a whole range of cities who might not be formally part of the organisation. And we're about to go through a major consultation project to try and get to some understanding of how we might do that without losing the purpose of our organisation. We would need scale and dissemination partners, I think. So that's occupying my time. I'm at a local level, though. One of the things I learned through my international work was about global inequalities. That's obvious and in your face in everything you do internationally. but it often means that you haven't taken that same lens within your own context. And I've been quite occupied over the last 5 years with the idea that Australia is actually an unequal environment. You're 230% more likely to die of cervical cancer in Australia if you are Indigenous versus not Indigenous. And, that is, we have low death rates, but that's not true in our Indigenous community. And so we need to address those. Even across the general community, you're 37% more likely to die of your cancer if you're poor versus wealthy. And so just raising attention to that is not a popular conversation in Australia, and in particular with Liberal coalition governments. So it's a little bit more popular with the more left-leaning sides of governments. It's not at all popular on the right, and because it's all should be a matter of you solving those problems yourself. So that really was one of the reasons why I left Cancer Council, because that it was seen as a too risky conversation to have, and yet is the fundamental one we should be having. So I'm now moved into a role where trying to, if you like, go back to basics and start with that within a micro environment like a hospital. So I'm working at Peter Mac and the university to try and see whether we can bring an equity lens into everything we do in one clinical service, and then from there think about how you scale it. But also at the university, trying to mobilise conversations that say, this is not a health issue, this is a broader issue. And so can we mobilise law and social sciences and other parts of a complex university around a purpose? And I've been quite taken with it. I read a book called Mission Economy by an economist called Mariana Mazzucato, who talks about governments needing to align around purpose and stop focusing on market regulation, but think about how they would manipulate markets to deliver on big picture purposes. And I think you can take a microcosm of that at the university level and really think about how you could mobilise very smart minds towards actually achieving something. I think universities often achieve patents and publications and grants, but maybe don't impact on the ground through a purpose lens. And let's see if we can make them do that.
Well, I think you just summarised your whole approach to life there, Sanchia. Impact through collaboration, innovative collaborations, focusing on the real issues, and sort of sums up a lot of the work that we've done together over the last 10, 11 years, and we'll continue to do. It sounds fascinating. Sanchia, as ever, just a big thank you from the UIC team for all the work you've done with us, and good luck in that new venture. It sounds like it's something we could definitely take around the world when you've nailed it. So anyway, great to talk to you, and we'll catch up soon.
You too, Cary. Thanks so much.
Cheers, Sanchia. Bye.
Bye.